Shannon.
And this is Kevin Ferreira.
And we're with Wow Aesthetics. We're here in Stevens Point today, and we have a Wow 5.
This is another Wow 5, and it's 5 common complications in medical aesthetics. You know, it's very essential for us to choose the people who do our aesthetics to make sure, you know, that they can manage these complications, because complications happen to everybody. Anatomy is different. A lot of things are different. You know?
And complication doesn't mean something was done wrong. Complications is a regular part of care.
Yeah, so it's important to the aesthetic caregiver to, you know these and know to manage them most. You know, and also clients, you know, should know to choose their provider. You know.
Be very diligent and, you know, take care when you're choosing your provider so that they can care for you correctly and manage these complications.
Yeah, that's very essential. Number 1.
Vasovagal response.
Oh, we see a lot of vasovagal responses in aesthetics, especially when we touch clients' lips.
Yes.
You know, we see that a lot. Lip fillers are most noted for
threads, lip threads.
Lip fillers, lip thread, whenever we touch the lips, our PRF in the lip, PRF gel. Anytime we touch the lip, even a lip flip. I've seen people, you know, go woozy on a lip flip. So vasovagal or the common faint is very, very, very.
And it can also be simply from an aversion to needles or blood that you didn't know you had. So that can happen there too.
Yeah. We see that too with some IV infection, and some people are also very fearful of needles. And we draw blood when we do PRF and PRP, and sometimes the needle poke might have one going vasovagal. Important to manage the common faint. We know that is a common faint, and it's always transient. So we just protect the client while they're out. You know, if you can, you know, stop them from a fall or something like that, that's the best thing. You know, keep them comfortable whenever you're going to give any procedures, in a comfortable position so they can't fall and hit their head or anything. Make sure the surroundings are proper for that. And, you know, we have IV fluid if needed. You know, that's never needed. Also, all that's needed is some cold therapy and some constant stimulation, and just be there with the patient and support them through the common faint. But we have an AED here, and we can support if we need to support. So that takes us to number 2.
Number 2 is nerve injury.
Nerve injury. We don't see a lot of that in our practice.
No, but it can happen, and it does, and it resolves. It always resolves.
And stretching on the nerves. You know, we do a lot of PDO threads, but that nerve sometimes it's very transient. I mean, by the time the client complains about it, then it's done. You know, and we recommend like warm compresses for this, and we can also use a therapeutic ultrasound, which we have used to great effect. You know, medications like, you know, the Kybella back in the day, that could cause some nerve injury.
Usually it's compression of some type. I mean, that's what we see most common in aesthetics.
And demyelination in the case of Kybella, the nerve lose some of its outer coat, and that causes it not to function. That's very transient, and, you know, in 4 to 6 months that does resolve. We do face tight also, and we are very common in the jowl area and submentum below the neck area, and we can get some nerve injury there.
And you know, we use ultrasound and mark them out, and so there's safe ways to do all these things, and that's one thing we pride ourselves in is making those extra steps.
Yeah, because we use ultrasound to mark the nerve out. We do not see any, you know, nerve injury, because we can, you know, pinpoint where the nerve is and try to stay away, you know, 1 to 1.5 centimeters away of the nerve when we doing radio frequency underneath the skin. So so ultrasound. So the summation for nerve injuries: ultrasound to mark out the nerves, and we'll stimulate. If we have a slight nerve injury, we treat our patient and follow them. So that's why it's very important to catch these things and to be able to treat them, you know, down the road. This takes us to number 3.
Number 3, bleeding.
There's lots of bleeding, and lots of types of bleeding. You know, most times we put a needle in the skin or puncture the skin, we can get some bleedings. Some noted area for bleeding is just below the eye. You know, it's hard to do a procedure like Morpheus and don't get a couple bleeding, you know, some sort of bleeding. We tell patients 100% you're gonna bleed, but you're gonna bruise, but we can make that go away in no time at all. That's when we employ icing before, icing while we do it, and ice for the first, you know, 24 hours to 48 hours after.
Prevent bruising, prevent, you know, if hematomas happen, you know, we want to do pressure and manage them right away to minimize the swelling and minimize the bruising for patients.
Cool therapies is the way to go. And, you know, bigger bleeding is, you know, beyond the scope of here, this talk, but when we do lumps and bumps, you know, you can have some bigger bleeding. We have electrocautery and Surgisil and those things to stop bleeding. But in most aesthetic practices, you know, is with the bleeding we're talking about is bruising of the skin and mild bleeding when you put pressure on, you know, take care of that.
Perfect.
This takes us to number 4.
Number four is lidocaine toxicity.
And this one happens.
This one is the most serious one. This one is life-threatening, and so talking to clients and, you know, just educating, bringing down the apprehension and making sure they're in good hands with somebody that can recognize it and manage it is the biggest thing.
Yeah. That's the nuts and bolts. You know, when you have a large body surface area, and you know, for example, we see that with in aesthetics is hair removal. You know, people doing whole leg or whole back and belly, and then they end up with lidocaine toxicity.
Or when you're trying to really give your patient the most value for their money,
for their buck. Yeah.
It's not always helpful to just do a lot of areas.
Yeah, that's question you should ask your aesthetic provider. Hey, what would you do if, you know, we have lidocaine toxicity? You know, if you know you're doing a big area, just don't volunteer for big areas because you're thinking you're getting some value.
Yeah.
You could put yourself in danger that way, you know. So you want them to have medications like the benzodiazepines around for the lidocaine toxicity, and you want them to also, you know, have lipids too and IV fluids, you know what I'm saying, and also treat the symptoms. You know, these people can get violently nauseous and vomiting and violent headaches, and you know, it will be able to monitor that patient, and you know, so you have to have that kind of ability, that kind of quick diagnostic skills to know that that's what's going on, and don't send your patient out like that.
Great.
Yeah. Last but not least,
number 5 is foreign body, or when you have migration.
Yeah, foreign body and migration is, you know, is mainly a filler issue. We put fillers in lip, and sometimes that distorts clients' lips, and they never look the same after that, you know.
Migration, anywhere you put filler,
and the fillers can migrate, you know. That's what you can either dissolve the filler then and do something else, or you can have sometimes fillers encroaching on vessel. That's a more acute problem where you have to be ready to do, you know, do the do. You have to be ready to, you don't want to lose tissue, so you have to, that has to be recognized fast, you know, because the filler doesn't have to go in a vessel to block the vessel. It can compress a vessel. And what happens, you have to rub that area, you have to have medications again, and you have to have, you know, hyaluronidase to dissolve this thing. You have to have nitroglycerin to rub the area, you know, and you have to have medications available to treat these areas.
And also threads can migrate, so if they get laid on, or if they move around from, you know, either poor post-care or aggravating them.
And you know, the large thread we use to pull skin up for elevation, those molded type threads, they can get unhitched, and then you can see it under the skin. Those are very, very difficult to pull out, you know.
It's done.
So that's why it's important that the patient, you know, it depends on the area, don't do too many dramatic actions. Because
baby them.
You know, no sudden movement, no, you know, drastic laughs, and you know,
soft foods,
animation, you know, and no hard foods. Yes,
I would say the biggest thing is when people lay on them. They can come, you know, they have barbs, and so they're anchored, and they can become unanchored, and then
Yeah.
But that's early. That's early when it happens. I mean, if you give it a few days to set in, it's not a problem. It's just really in that early phase.
And there are some notable honorable mentions is like getting filler in a vessel or something like that. But we haven't had those
like
complications. A vascular occlusion. But we always thinking about it and using the skills to avoid it, whether it's ultrasound, whether it's injecting the filler in a retrograde manner. All those things help to increase the patient's safety profile when we do this procedure. So there you have it. That's another 5.
Yes.
5 things, 5 common complications we see in aesthetics. I know there are more, but
if you have any questions or you want to contribute to a conversation down below,
yes, this is Wow Aesthetics, and remember, we meet you where you are.